Hello and welcome to Asheville, my hometown. I'm John Mile, Risk Manager for the City of Asheville. For the next few moments, we want to take you on a virtual tour of our community where you can see firsthand what a group of dedicated individuals did when they decided to forever change the way we deliver and pay for health care in our community. Starting 5 years ago with only 46 patients, the program has now grown to over 500 patients in 4 different disease states.
The program has meant more to me than most people could realize.
When your blood sugar is controlled, you feel better and therefore you can work better.
Really, I think I'm in charge of my diabetes.
This means that I can live.
The initial program tested whether patients with diabetes would benefit from the education, training, and the professional expertise of registered pharmacists who would receive special training in disease state management. Patients were assigned to a pharmacist based on geographical availability and were scheduled for ongoing visits with their pharmacists. Patients were provided with glucose meters that would allow up to 30 days of readings to be stored and downloaded to the pharmacist's computers during regularly scheduled visits.
If I had to capture the Asheville Project in a nutshell, I would say there are 2 main issues that it accomplishes, and one is collaboration among the care providers, the educators, the pharmacists, and the patient, as well as collaboration with the employer organization. So there's a collaborative approach to taking care of chronic disease that heretofore had been very expensive and not well managed. The second issue of the Asheville Project had to do with the compliance, and not only compliance with medication, but compliance with all the other activities that are so important to controlling diabetes.
It's extremely important to have employees appreciate what you're doing for them. But there's another benefit too, and that comes in the cost savings to the city from helping the employees manage their own health. We've cut our downtime in half. Our sick leave has dropped from 12 days per employee per year to 6.
The project has shown that hospitalization costs for people with diabetes have been reduced by an average of $2,000 per patient per year.
We did this in the beginning with the expectation we might see some savings down the road. Nobody ever expected to see the quick, short-term gains we actually got. And the fact that other employers have begun to see those very quick, short-term gains as well is a very good incentive for employers and payers everywhere to consider alternatives to what they're doing with healthcare.
Measures that we've used to determine the success of the program, we follow clinical parameters, hemoglobin A1Cs, we check cholesterols on a regular basis, and those clinical numbers have gone from an average at enrollment A1C of 8 to at 5 years for the individuals who've been in the program, that length of time, to an average of 6.8. The goal being less than 7, which is established by the American Diabetes Association. LDL goals, another clinical goal, is that be less than 100, and the group's average has consistently been less than 100.
Our intention had been at 12 months to hopefully see some outcomes. In fact, what surprised us was at 6 months, not only were the outcomes we were tracking beginning to show very good results, but the employees themselves were so excited about the program that we agreed to start compensating pharmacists much earlier than had been originally thought and retroactive to the beginning of the program.
It keeps them out of the hospital. They would have somebody who's there, sort of like a support person.
We hear a lot about pharmaceutical care in school and working in physicians' offices or one-on-one with patients, but this has made my dream a reality.
Central to the success of our program was educating employees to their disease states and the things they could do to better care for themselves. That wouldn't have been accomplished without the staff at the Diabetes Education Center at Mission St. Joseph's Hospital.
Research has shown that the more frequent the contact with a healthcare team member, the better the outcome with a person with diabetes.
It's kind of like anything else. If you got somebody coaching, you'll do things a whole lot better than you will if you try to do it on your own.
I think pharmacists can add a whole lot to the healthcare system from a lot of different aspects, as far as offering what they can offer to a wellness program or a disease state management program that an employer offers.
I see the pharmacist serving as an access to answer questions, health-related concerns, not only about medications, but about some of the other aspects of disease management.
The physician has a role to play, the person with diabetes has a role to play, the educator has a role to play, and so forth. The pharmacist plays a role in being able to make contact with that person on a more regular basis, and also has input into their medications if there are complications. And care for diabetes as well as other illnesses today is so complicated, and there's so many potential sources for error and confusion that having more people involved is a good thing.
Support of top leadership within the community from both the hospital system and the City of Asheville was a very important factor in our success.
You know, the partnership is what makes this thing work between Asheville and Mission.
Partnership with the City of Asheville has been one that I think has brought our two organizations closer together. A private organization, which we are, and a public as they are. And then a sense that we're doing the right thing.
This was something the city did not have to do. They chose to do it. And it was just, they were empowering us to help us and help the city at the same time. The proactiveness was just incredible.
Being able to get my medicines free, that's a big help. But more than that, it's the health thing, the checkups, you know, like going in for the screenings, you know, and Mr. Wett, who was the diabetic and the blood pressure counselor, you know, coach almost, you know. It's a good thing. It's given me a new perspective on my own health, or taking care of myself.
In the beginning, we realized our employees would respond best to some sort of an incentive. It seemed reasonable in terms of cost and ease to just waive copays for their prescription medications and test strips as relates to their diabetic conditions.
The incentives, I think, are good to get people engaged, to engage them initially. But these folks don't stay in the program for the incentive. They stay in the program because of improved health and because of improved sense of well-being.
It was very exciting to me because I said, finally, somebody has hit upon what I really believed was a program with some real teeth, a program that would really benefit the employees.
This has been a tremendous return on investment in terms of what we've spent on additional medications, pharmaceutical care services, and other expenses related to the program. The actual ratio is somewhere around $4 to every $1 spent.
Well, I would say look at the numbers. And the numbers speak for themselves. My decision really was sort of easy once I saw the numbers. It's almost, as they say in these days, a no-brainer. When you see that you can save money and improve the quality of life for the patients, the decision's already made.
Managing those patients, as we have done with our employees and with the city employees, with the Asheville Project, I think will be a precursor of the way we're managing most chronic diseases in the future.
The future for this program is very bright. I think that we've definitely overcome obstacles along the way, and I just see it expanding.
Looking at Asheville as an example is a key, because that shows what can be done and what can be accomplished. And we're happy to tell our story to anybody that wants to come and talk to us about it. And I know Mission is happy to do that as well.
The partnership between an employer, nonprofit healthcare provider, academia, professional associations, physicians, community pharmacists, and a PBM has created an unparalleled system for care, yielding better outcomes at a lower cost per patient.
This program probably saved my life. I sincerely mean that.